webinar. Today, our webinar is Why the Tightness, Understanding and Managing Radiation Fibrosis. As always, just a little disclaimer, everything presented here is for educational and informational purposes only. Yes, there will be a Q&A section, but just be mindful that not everything presented here is medical advice, so it really speaks to your healthcare team if you have any specific concerns. So just to introduce who we are at Well Beyond Breast Cancer, firstly, I am Amanda. I'm the founder and executive director of Well Beyond Breast Cancer. And we are a nonprofit organization that's dedicated to really expanding access to breast cancer rehabilitation. So this is a specialized field of physical and occupational therapy that's really there to help you minimize and manage a lot of the cancer-related side effects that you're potentially experiencing. We have three main programs, the first one being our financial assistance program, where we are partnering with wonderful therapists across the US to fund appointments of physical and or occupational therapy for individuals who are experiencing financial hardship. We also offer these educational workshops where we are essentially partnering with wonderful experts like Kelly here to bring you evidence-based information directly in the comfort of your home so you can better understand possibly what you're experiencing in your body and then next steps to help you get to the place that you want to get to. We also have a podcast where we highlight survivors and pre-survivor stories, in addition to highlighting expert advice from oncologists, breast surgeons, PTs, OTs, and other healthcare professionals to bring you more information about what recovery can actually look like. So that is who we are. And like I mentioned, educational webinars is something that we do here at Well Beyond Breast Cancer once a month. I am very honored to introduce our sponsor of today's webinar, which is BeeCure. And we have Steve here, who is representing BeeCure, who will share all about the wonderful company with you. So Steve, I will hand it over to you.
Thanks so much, Amanda, and thank you for having us. This is a wonderful opportunity to learn more about just a topic that affects so many people going through breast cancer. For anyone who doesn't know, I'm Steve Weinstein. I'm the CEO, and I call myself the Chief Hive Officer of BeeCure because we're all about leveraging the medicinal powers of honey and other natural ingredients to actually help for people going through radiation treatment for any cancer, as well as post. It can also be if you're affected by chemo effects on your skin, surgical effects on your skin, as well as just after the fact of having cancer, if your skin is less elastic, tends to get tighter, lower levels of estrogen, just more compromised skin issues. So we are all about helping people to feel better, look better, and heal better naturally. We think we're a healthier and more effective option than what a lot of people get recommended. BeeCure is dermatologist tested and clinically proven safe for sensitive skin. We actually test it on people with sensitive skin to make sure there's no breakout or inflammation indications on your skin. We are steroid-free. We are synthetic drug-free. We are also gluten-free, just in case that ever comes up as well. As I said, buckwheat honey, calendula, which comes from the marigold plant, and bisabolol, which is German chamomile, have all been studied and proven to be very effective at actually reducing inflammation, reducing redness, pain, and itch, and most importantly, helping to strengthen the skin barrier. So much of the issues that we all have with our skin are because of weakened skin barriers. And if you can keep your skin barrier strong, you prevent the burn, the irritation, the inflammation, the dryness, the itchiness of your skin, including the symptoms from radiation fibrosis, which Kelly will talk about more. One thing about us, if you don't know, we're relatively new. Our product's been in market only about 2.5 years, but some of the other partnerships we have besides Well Beyond Breast Cancer are the National Breast Cancer Foundation. They put out about 30,000 Hope Kits a year if you happen to have received one. Since last February, we have been their chosen radiation cream that they put in their Hope Kits. Also the National Lymphedema Network as well, because we also don't interact negatively with compression garments. We're not an oil-based product like a lot of the healing ointments or other lotions are. BRCA Strong, the Breasties, and certainly Well Beyond Breast Cancer. We are thrilled to have these partnerships. And again, you can see what some of the customers have said about us. People tend to like us. The effects happen very quickly, and a little goes a long way. So we're also a really good value for people. And the most important thing is that as a partner to Well Beyond Breast Cancer, is we want to help you and help everybody that you know, as well as give back to Well Beyond. So if and I think Amanda will email this to you, so just in case you don't catch it now, but there is a code, a discount code. If you come to BeeCure.com and order BeeCure, you can use the code WBBC 20, so stands for Well Beyond Breast Cancer 20, to get 20% off anytime, any quantity of BeeCure that you buy, and any of the proceeds that come from this code, those orders using this code, we will donate 20% back to Well Beyond Breast Cancer. It is not a one-time thing. This is every time, all throughout the year, every year. So please share with your friends and family, anybody who you think can use the help. One other thing, we offer a money-back guarantee because we feel so strongly that BeeCure will help people. If it does not, if you happen to not like it, or just it didn't work for you, which is very rare, please just let us know and we will give you your money back, because we don't want you to be out during this time when you have other things to focus. So that's enough about BeeCure. I will turn it back to Amanda.
Thank you so much, Steve. And again, thank you so much for being one of our incredible partners throughout the year and just continuously supporting our mission and all of the work that we are doing. So thank you, thank you, thank you. So now I have the extra honor of introducing Kelly, and she is our speaker for today. So Kelly is a board-certified oncology clinical specialist. She's a certified lymphedema therapist, a doctor of physical therapy, and the founder of Cancer Rehab PT. So Kelly, I will hand it over to you for the rest of the presentation.
Great, thank you. Just move over here. Well, thank you, Amanda and the Well Beyond team for inviting me out today to talk. And then also thank you, Steve and the BeeCure team for sponsoring it. We really appreciate that. And thank you for being here. So I am a PT, been here for doing this for 13 years. I'm based out of Minnesota. I have worked in an outpatient setting and a private practice for the last couple of years, treating anything related to cancer rehab, primarily breast cancer rehab, and also lymphedema. So what I want to go into today is I want to start with something that I think is important to understand, because for breast cancer in our rehab world, you have heard probably a lot of therapists speak on how we really dislike hearing the phrase, no, this is the new normal. And we don't like that because although things are, common, they're not normal. But I also want to go back to how these things are common, because so many people are like, is this what I'm supposed to feel? What am I feeling? What's going on? And just show you that it is really common to have some of these symptoms and side effects. So 70% of individuals report having tightness in the chest, loss of range of motion, stiffness in the area, even 5 years after breast cancer treatment. So it's extremely common to have these side effects especially after radiation. So we're going to talk a little bit more about what we do for this and how we treat it, but just know that if you are having tightness, you are definitely not alone. And there are a lot of people who also need that support and help. Before I go any further, I just want to share also one other patient story for you, because there are some of you who might be here newly out of radiation, or within the last year or two, you've had surgery or radiation. And there might be some of you here that are 5 years out, 10 years out, or even longer. I had a patient who was, I think it was like either 32 or 33 years out from her radiation. And she also had surgery and radiation for her breast cancer. And she came to me with her tightness and restriction. She couldn't lift her arm even to just about shoulder height. It was just so tight. And she had been living with that for over 30 years. She never had rehab, never had therapy, didn't know we existed, just assumed that this was her normal. And I just wanted to bring her up because I probably spent 2-ish months working with her every week. So it was a little bit longer than I typically do. But we made enough progress for her to be able to reach up overhead, not quite to the other side, but much better, so she could bathe, dress, have a lot less pain, a lot less restriction compared to what she had before. And I just want you to know that I don't know how far out you all are from your radiation, have these restrictions, but just know there's not such a thing as too late to address it. So I get questions all the time is, I'm 3 years out, can I still make change? I'm 5 years out. Yes, you absolutely can. But someone 30 some years out, we still made significant change. So just want you to keep that in mind. When we think about, do you mind going back just one slide for me? So think about for just a moment, if you have felt that pulling and that tightness, that reaching overhead, you can put in the chat if you have, or you can just think to yourself, if you reach both arms up, is one side different than the other? Do you notice compare the side that you had radiation compared to the side you don't? You feel the difference. Do you feel tightness? Do you feel pulling? Some may notice they just have issues buckling their seatbelt in the morning, or some people get woken up at night just rolling over because they feel it, getting dressed, bathing, all of these things that I hear, feeling that restriction. So if that is you, this is what we're going to talk about today, specific to when it comes from radiation, and hopefully shed some light on the things that we do in cancer rehab for treatment. Just to give you an overview of what radiation fibrosis is, so you have a better understanding and tying it to what you might be feeling. So I usually explain to my patients that it's very similar to scar tissue. To let people understand the concept of scar tissue, we see the scars, we feel scars, but fibrosis can be deeper, and that can be challenging to understand. When we think about radiation in that whole area that was radiated, we call it the radiation or radiated field, it can cause damage to the tissue with the goal of it, getting rid of the cancer cells, of course, but it can also affect the tissues around that. And when that happens, your body takes that as an injury, and it causes inflammation in the area. Some people get a little swelling, some don't with that process. And it's your body's natural healing process to want to build up this fibrosis, which really is collagen and fibrin. It's kind of like scar tissue. It builds up to protect you from a future injury. Same thing as scar. If you had a surgery on your knee and your scar area after you heal might feel thicker, it might be a little tighter on the area, it's because the body builds up enough collagen and fibrin so that you overcompensate so you don't injure that again. But what happens when you have a whole area of the body that has this, it's not just this area of the skin that had the incision like you would in a surgery. It's now all the layers of the tissue that might be in its path. So it might be your skin, which we see. It's the muscles that you feel, but it's also can be fascia. It can be nerves, and can even be organs if it gets deep enough. So just understanding if you have all of this scar tissue like fibrotic tissue through all these layers, that's why it makes sense why you feel so tight or you feel so restricted. I like this image. The top is a healthy muscle tissue and the bottom has fibrotic tissue in it. You can see it creates almost like a spider web through the muscle fibers. So again, it's not just one layer on the outside that you visually see, but it can be deeper. And that's might be why that you might feel it more. And this is what radiation fibrosis, how it differs from a typical injury, like I said. The scar, and for incisions, you might have scar tissue that goes deeper, but fibrosis from radiation can hit deeper layers. This is going to vary person to person. Everyone has different dosages and different directions the beam from radiation goes and the size of the radiation field. So it's going to vary. But in general, we only will see this happen, or the effects happen, in that radiation field. It's not going to happen anywhere else. It will stay there. But we also need to think not what we see on the outside, but what we feel deeper, and really assess that and also treat that as well. I hear quite a bit with my patients who come to me who feel like they've been really trying their best, and they absolutely have. They've been doing stretches, they've been trying different things, but they still feel tight. And why is that? And I just want to be very clear. It's not a sign that you're doing anything wrong. It's more of a thing. There's more to it than that we would love to get you more support if we can, coming from the cancer rehab side. We genuinely just know that there are not enough therapists and clinicians out there who are trained in this. PTs and OTs don't get this as a baseline in their general education, their general training. So those who have training have done excess training on top of it to learn this. So that's why there's such a struggle to find therapists who can support you. We know that's a barrier. That's something that, Amanda's team and we and myself are working so hard to bring awareness to, because we do need more people to support you all. So this individual in this picture, I actually just worked with her last month. She had surgery and had, I think, 22 lymph nodes taken. 3 were positive. So she actually had 2 surgeries because they had to go back, and then had 30 rounds of radiation on top of that on her left side. And that was 6 years ago. And she had therapy after. She saw a couple of therapists. They worked on stretches with her. They worked on, I believe, fascial release and then some nerve glides or some other exercises. And she has been very consistent the last 6 years working at it. But she was told, in her words, she said to me, they just told me there's nothing else they could do and they didn't know how else to help me. And I don't blame the therapist. That's just something we don't have a lot of training for all therapists to have this yet. But her and I worked together and we added another layer of treatment, which was the hands-on, which I'll get to a little bit later. And this is one session. This is her before and her after from our first session together. And she's 6 years out from her radiation, from her treatment. So just again, to show you that it's never too late to make progress. And our goal is to help someone improve their motion, improve their function, decrease their pain, get back to focusing on what's most important to you, and not be limited by the effects from the radiation itself. I have this slide just to talk through the different phases of radiation fibrosis, because you all might notice that you may fit in one category and someone else might fit in the other. So it can get confusing if you're just talking amongst each other of what am I feeling, what's going on. So there are 3 phases to that radiation fibrosis process, meaning after you have radiation and you start to build that collagen and fibrin I spoke about, that kind of scar tissue fibrosis feeling, that process can be short for some and it can be really long for others. So phase 1 is the acute. That's during radiation, and even the first 3, maybe 4 weeks out after radiation. Most people feel pretty well besides the skin, meaning they don't have tightness, they're moving well. They might be very tired though, because surprisingly, people don't think about this, but radiation, it can cause a lot of fatigue due to the complexity of the healing process going on. And then we get to the early delayed. It's really about a month out to maybe 3 or 4 months out after radiation. A lot of individuals will start to notice that they start to feel the tightness come on. They reaching up, they start to feel a little stiffer. They're starting to notice some symptoms, and some will speak up and say, I'm feeling this, and some will just not really sure, but continue to move on. But really that peak, that phase is where I try to see most of my patients to make as much change as possible. But all that is a sign that the radiation fibrosis is starting to build, and it's really your healing process is working through it. And then the last phase is that late to chronic. So for some individuals, the most common I see is early delayed, but some people will feel no issues, have no problems, and be living life and feeling great 5 months out, 9 months out. And then all of a sudden, around 9 months out or even 12 months out, they all of a sudden start to feel tight. They start to feel these side effects all of a sudden, and they had no issues prior. Why is that? That healing process I talked about of that collagen and fibrin building up to heal itself was just slower for those people. It's just the genetic piece of this that we don't always control. And so you're still in the time frame of that fibrosis can be building, but yours might look different than someone else who noticed it at 2 months. But how long does fibrosis build for? Some research will say 1 year, some will say 2. And so know that if you're in that time frame, you might still notice changes. You might feel like you're going 1 step forward, 2 steps back during that, because it's still changing during that time. But the more we can do during this phase, I think the better outcomes we get long-term to minimize how it affects you after that. This is, I think, one of the trickier parts is why working with a therapist one-on-one is really helpful, because there can be a lot of things going on, and it can be hard to decipher, is this from radiation? Is it from scar tissue? Is it from the surgery? What is limiting me? So the most common symptoms that we see for fibrosis are pain, tightness, stiffness. And then if you feel the tissue and compare it to a side that didn't have radiation, it might feel a little thicker, a little more firm. Some people notice more like ropey feelings. That's what we see the most. There may also be some weakness. We think about fibrosis. It can, like that picture I showed you, it kind of spiderwebbed through the muscle. When it embeds into muscle, the muscle may not contract as well as we would like or how well it did before. So some people notice a little weakness, swelling or lymphedema. That can be from surgery, but it can also be from radiation due to the damage of lymphatic vessels from the radiation. Some will have nerve symptoms, tingling, numbness, things just feel different. Restricted arm motion is a big one that I see. You see this a lot on the images I have here. And then for those who have it affecting deeper, not everyone gets this, but those who have it affecting more around the lungs, they might notice shortness of breath, coughing. And I'll also say some might notice just like a tight band around their chest, they say, because it can even affect the muscles that are deep between the ribs. So those are really the main signs. We still get tightness and pulling for scar tissue, so that's why it can be challenging and why getting assessed by a therapist can help you narrow in if this is really radiation related. We're going to move on to treatment and hopefully spend the rest of the time over here. When it comes to treatment, everyone's going to differ, but there's a major framework that I've always followed and I have found very successful. And there are different pillars to what treatment is. And I'm just going to share the three main ones. These are really the foundational that I do with all of my patients to a different extent for each, but stretching, hands-on or manual therapy, and then strengthening or exercises. I give each person these. Some I focus on first versus others, but these are all really the three key pillars with some others that I'll chat about in a little bit too. First, we're going to talk about stretching. This is one that most people are comfortable with or have heard about and may have been doing consistently. And there might be a couple things that we could do today and talk about today that you can tweak for yourself when it comes to trying to stretch out muscles that have been affected by radiation. When we think of tightness from radiation or a muscle that has fibrosis in it, it's not the same kind of tightness from just, you were sitting too long, a restricted style muscle. Those are very different muscle types at that point. So we need to change how we think about stretching for this. When it comes to the tissue with fibrosis, we want a longer hold. And that's due to that fibrosis embedding into a muscle and causing or losing that elasticity of the muscle or the pliability of it. So when we do a gentle, longer hold, we have better outcomes of improving the muscle length. We want to try to work up to holding for longer, 1 to 2 minutes at most. I say 30 seconds, I think makes a significant difference as well if you can work to that. And I promise you, if you've been doing 10, 15 seconds and you jump to a minute, you're not going to like me. So I always say, just start slow and low. Start with 5, 10 seconds, and each week try to increase how long you're holding it. So gradually build up to that time frame if you're not already doing it. We want to always keep it mild, keep it comfortable. If it's so intense of a stretch and you're kind of tensing up, and you're not relaxing into it, you're not allowing the muscle to relax into that stretch. And so keep it gentle, keep it mild, scale it back if you can't relax into it. It should not be painful as well. You'll feel the stretch, but it should be comfortable. And then one thing I always do, and if you follow me, you know that I always do this, I always cue my patients to add a deep diaphragmatic breath in between with each hold. Meaning, so we get to the end range of a stretch, like in this picture, when you feel that mild amount of stretch, you take a breath. And I always cue, when you take it right into the area of tension that you feel your ribs expand right into that area. And then as you let your breath go, let yourself relax and sink into that stretch further. 2 things happen. One thing that I think is very important. So you have those deep little muscles called the intercostals. They sit between the ribs, like on that picture. And for us who are manual therapists, it's really hard to get to those muscles for many of our patients. Some we can, but most it's difficult. And so when you take that breath, you're expanding those ribs and you're allowing for a natural stretch and mobility to those intercostals. So it helps you with deeper muscles that might be causing some tightness that's deeper. but it also for you allows you to relax your nervous system, release the tension of the muscle so that you get more out of your stretches. And then the other piece we focus on as therapists when we're thinking about what stretches should you do. This is hard for me to share in something like this because everyone needs something different. But what we want to do is ideally, we're trying to assess for you where the root cause of your restrictions coming from. What muscles are the ones most affected that when you try to reach up overhead, where is it restricting you? Where is it pulling you exactly? And my goal is to focus in on that root cause, because if we can make change to that specific area, your motion improves, your pain goes down, your tightness goes down. It's not wrong to stretch everything. That's great, but I know that's not realistic for doing this every day. And so I say, let's pick 2 or 3 stretches that focus in on the area or the muscles that you need it the most. And that will look different for each person. But when you are assessing or self-assessing, what motions or positions make me feel the most tight or restricted, feel where that is, and then let's mimic those stretches so that you're focusing in on those areas. The number one muscle that I see when it comes to breast cancer is going to be that pec major, the one in the illustration, that big muscle across your chest attaches up by your shoulder. Number 2, underneath that, there's a sneaky one. It's a small pec muscle called the pec minor. It actually attaches to some of your ribs. So some people will notice rib pain or tightness from that one. And then there's other ones. Some people will get even tight around their shoulder capsule. There are different muscles. The lat muscle, which is the wing muscle that sits kind of on your side and your back, that one's also sneaky. I would say 20% of my patients really have restriction there and don't realize it. So again, we are in therapy, we're assessing where you're restricted and kind of create you a program. But if you're at home without support, reassess for yourself, where do you feel it the most? When you lift your arm up, where is it pulling for you? That's the area that we want to pick stretches for. And then what we talked about before, focus in on longer holds, gradually building up to that, keep it gentle, and then add that breath in and relax with it when you can. These are some other muscles that we stretch. And a question that I get asked quite a bit is whether or not fibrosis or radiation fibrosis can impact other muscles in the area, maybe that weren't radiated, like the neck, I hear a lot, the back, I hear a lot, even into the back of the arm, I hear a lot. Can those be affected? And the answer is not directly, but indirectly it can. And I'm going to try to explain this well. So again, you are only going to notice fibrosis in that exact area that you had radiation. It's not going to go outside that area. But if where your radiation was pulls on muscles, like for the pec major example, that attaches to the shoulder. And if that one's really tight, what it's going to do, it's going to naturally want to pull your shoulder forward because it's tight. And then that cascades. So when your shoulder is always forward, your back and your neck muscles start to take a hit because they're always strained. So some people will notice neck pain and back pain more than anything. And that's really due to that postural change, that compensation change. And so we still want to add stretches and support these muscles. So when I say is it affected by radiation? Not directly, but it can very much indirectly affect you and how you move around and how you use it. The other thing I want to say before we move on is I see a lot of chronic shoulder issues for those who had breast cancer in their history for that same reason. That tightness in the front pulls it forward. And so the joint positioning is a little bit off from what it was before. But then you go on and live your life. You have to. And so when you're reaching up and you're doing activities and you're using it day to day, you're doing it in a little bit different positioning than you did before. And 2 things happen. One, it can be the positioning of the joint over time can have this overuse, like inflammation, because it's kind of jamming in the front over and over. So I see a lot of what we call impingement issues in the front or shoulder inflammation issues. And then the other thing we see is if you're reaching up and you're restricted on the bottom, you sometimes hike up your shoulder a lot to compensate. And then so we see neck issues from that compensation side of how you're using your muscles. And so again, we're just, as therapists, we're trying our best to make sure that we're looking all of these pieces for you and giving you a program and stretches that address not just the radiated tightness, but also the other muscles that are affected. And this is something that I see a lot. And I want you to go back to the 3 phases that I talked about. And if you're in those first 2 years, some people actually go a little bit longer in my opinion, but if you feel like I'm stretching, I'm doing it all, and I feel good when I do it, but then the next morning I wake up and I'm tight again, you know, what am I missing something here? What's happening? One, it might be that you are very much still in that healing process. So it's going to continuously feel like that cycle for a while. Please just stay as consistent as you possibly can and keep going. But for some, you might be 10 years out, you might be 15 years out from yours, and you're wondering why you're also feeling the same cycle. Unfortunately, we also have just life and aging and how we sit all day, or if you have a desk job, there's just that aging functional piece to life. Aging is the easiest example, is just as we get older, our posture changes, our muscles might not be as flexible, we might have some more weakness. And when you have the fibrosis on top of that, you just tend to notice those changes quicker than another area of your body that did not have radiation. So you also feel like you're in the cycle. So if you're in the cycle, again, our goal with rehab is just to help you break that cycle and find ways to move the needle so you're not going 1 step forward and 2 steps back all the time. So moving on from stretching, we're going to go over into that hands-on or manual pillar that we're talking about. This is one thing that I do with every single patient, but this is also the one that I think 2 things. One, it's missed a lot with therapists who maybe don't have the knowledge or the training behind fibrosis, but 2, it's something that's very challenging to do at home. Don't have the skill set to do that at home on yourself. So there's big gap here for multiple reasons, no one's fault. This is one, though, that I feel personally has moved the needle the most for my patients when we can work on it. And if you've tried some, I just want to give an idea of how I do it. So when we think about, again, fibrosis, it's not just the layer of the skin on the outside like a surgery. It's also going into deeper tissues, muscles, fascia, nerves, down the line. I use a layer by layer approach. So I am looking and assessing around the skin. But then I'm also going to the next layer of tissue and assessing. And then I'm also going to the deeper layer and assessing. And I'm going to find something different at all 3 layers. But if I only ever assess the skin, I'm missing the deeper issue. And if I only ever assess the deeper issue, I might be missing restriction at the skin. And so I want to be very comprehensive when I'm working with patients. That would be ideal if you're with your therapist, to making sure that we are finding all the restrictions that you might have, because all of them can play a role of helping you get your motion back, of helping decreasing that pain and that restriction. Our goal is to try to use our hands-on techniques to soften that fibrosis, mobilize the tissue, and help the muscles and the tissue restore their glide and their elasticity, meaning they're kind of contract, relax, so everything's not feeling so tight. We have a lot of different techniques that we do, and some I teach my patients for home, some are a little more challenging for home, and so we use that shared, approach of doing some homework and then some together. If someone has the ability, and it might be too late for so many, but to use some of these techniques before radiation, I do get referrals from the radiation oncologist to do some of these techniques before radiation if the person can't get into that position for radiation. So some people might have therapy prior. And I don't do hands-on techniques during radiation or for the first few weeks out after, to let the skin heal, let the tissue heal. On rare occasion, I will. It's usually a decision between the radiation oncologist, the patient, and I, because there's something is happening or changing we need to get onto sooner. But most of the time, we hold on the hands-on piece for about a month out when you're fully healed. These are just pictures of some of the techniques that we use. They are very simple, but a therapist might do what we call like a pinch and lift. So we're trying to think about the tissue might be adhered or hard down. We're trying to pick it up from whatever might be adhered on, and then we're mobilizing it. So I pinch up and then tissue roll through. And it's kind of hard to see, but you're just kind of lifting it away and then rolling through. So I do that at the skin. I do that deeper, and then I'll even work kind of right into that whole muscle belly and do the same thing in there. And that tends to work really well. We might also do what we call tissue bending. Some therapists will say C's and S's. And it's really just another version of a stretch that we can localize specific to a really tight area that this muscle with fibrosis responds better to. So that's what the bending of the tissue looks like. It's specifically to stretch a localized area. And we might do fascial release for tightness on the top. We also do a lot of scar mobilization in these areas. DISM, I have a picture on the next slide. I'll get there in a minute, but it's like a grip assisted piece that we can do like a self fascial release. And then we'll also do, I also use the term kneading dough a lot when I am teaching it. But when I'm in there, like massaging and moving, and I'm thinking about in my mind this gently kneading dough, because that's how I'm trying to soften it. If you think of, I don't have it in front of me. If you think of a piece of paper and you try to stretch a piece of paper, it's not going to stretch. And that's kind of like collagen and fibrin. It doesn't have stretch to it. It's tight. And the same, so think of that as fibrosis, like paper. But if you take a piece of paper and you just started to crumple it up, like you just start to just gently, continuously crumple it up and just keep going, open it up and re-crumple up, what would happen over time? It would start to soften and fray apart. That's the concept that we're going for when we're doing hands-on. So if you're doing that, just gently kneading dough in that way, in that tissue, it helps soften the fibrosis. In the clinic, I'm usually doing it 2 to 5 minutes in a certain area. I'm usually doing different techniques, so I'm changing it up. At home, when I'm encouraging someone to do this, I'm teaching them. It's usually for a minute or two at most at a time, and then moving on from it. So a little at a time. But that's a big component of treatment that I think makes a big difference when it comes to fibrotic tissue and also scar tissue. Other tools that you might see what we do in kind of this manual or hands-on umbrella, a low-level laser at a medical level. We use that a lot for scar tissue. It helps decrease inflammation, and it's also used for some lymphedema. And so on occasion, I'll use that. I use a lot of instrument assisted, so like a small cup, and not in a traditional sense of using cupping, but I use it when the tissue is so adhered or stuck that I can't pinch it, I can't lift it. So the cup just very gently, very lightly, gently lift it up and then mobilize it. It's the same concept that I use my hands with, but I need help with the tool. So always very gentle, always very light, always making sure that I'm on safe skin and that the skin is fully healed before I do anything like that. And then these are just pictures. I couldn't get the videos to embed, but hopefully that gives some idea that, especially the bottom pictures, that I'm using a good amount of hand. Actually, the last one is the patient's hand. I'm teaching her how to do it, that we're just starting to work into the tissue, mobilizing it, working into the areas that we feel restriction, softening it. And then that red piece is that DISM I mentioned. It's just like a sticky grip. It's used to like help open jars and making sure things don't slide on your table, but it works well for someone to localize. So for that person, she's doing a stretch, which we've showed another, in the stretching section. But if you do a stretch and you don't feel like it hits that area that you notice it the most, maybe you feel it down your arm, maybe you feel it somewhere else. It just doesn't feel, you don't feel it where you want to feel it. Using your hand or using something like that right on the area you want to feel it and gently pulling the opposite direction will help someone localize or narrow in to feel the stretch there. So we use these things as a tool really to make sure that you are getting the most efficient stretch or technique in the exact spot that we want to feel it. And this is where self-treatment and clinical treatment really, I think, go hand in hand. Is there are so many things that you all are probably doing correct. Where you're probably doing stretches, you might be doing some hands-on, you're probably doing strength or exercises, and they're all very, very helpful. But what I mentioned before is a lot of times there's something missing within those pillars, those 3 main pillars, that could really move the needle for you that might not be on your plan right now. And I think the gap is a couple of things. One, it's hard to find access. I'm very, very aware of the barriers that we have of getting you all to cancer rehab. There's a lot of limitations. We don't have enough of us out there. So that's a barrier. But the other barrier is when we don't focus in on the root cause, which is usually the fibrosis, and we're just doing general stretches, or we're just doing general exercises, but not trying to really get to, what is causing that true limitation, then we're usually not getting where you want to be. And so when we switch that and we get a lot more specific about what you need and individualize it to you and where your issues are, that's when we start to see those results. That picture that I had, the before and after, and that's 6 years out, one session, had therapy in the past. We just changed a little bit, did a different assessment, focused in on that session on where we found the issue, and you could see the dramatic difference in her emotion even 6 years out. And so that's really the goal. This is not a one-size-fit-all protocol, unfortunately. That would be a lot easier to share in this presentation of what to do, but hopefully that narrows in on what our goals are, our pillars are, and then we have to try to individualize it from there. And then the last pillar is strengthening. This is one that I don't tend to give right away. I want to focus on getting motion back, getting pain down, and, improving the softening of the tissue with the hands-on. And then I usually add on strength later. It's never wrong to start strength earlier. If I'm trying to narrow it and keep it simple, this is what I add later. And it really goes along with a couple things I've already shared. One, the muscles can be affected fibrosis. So we want to make sure that we're getting a good contract, relax from the muscle activation. So strength does that. Two, we talked about how if you have tightness, and especially in the front, it can affect your posture, your positioning. That can affect how you compensate with your shoulder. And so we want to make sure that we are supporting the back muscles, the neck muscles, to help counterbalance that. Also making sure that your shoulder is healthy long-term, because we see a lot of chronic shoulder issues if that's an issue. But when you do strength, start low and slow. You can start with no weight, 1 or 2 pounds. Doesn't have to be much, but we want to try to focus in on picking muscles that are helping your shoulder blade, so your scapula area, the stabilizer, the foundation of your shoulder, and then also even your rotator cuff and maybe even your neck support. We can always add more, but the idea is we just want to make sure that you're also balanced out in the back from the tightness in the front. I always try to, unless there's a major injury issue, I always want to try to focus on what your hobbies are, what your goals are, because everyone varies. I have someone who's a photographer and that's her career, that's her job. And so she needs to be in these positions holding this heavy camera. So we need to make sure she's supported to be able to do that. So we focus on muscles that help her do that. If someone loves to play pickleball, same thing. What is that shoulder joint doing? I want to make sure I'm adding that. And so when you're picking exercises, you don't have to sit there and do 20. If we can think of the 3 that would help you support what you need, that's what we want to focus on the most. Coming back to review, just overview. So we have the 3 main pillars. We had strength, manual, and strength, or stretching, manual, and strength. There are also other as well. There are adjunct and other supplemental that I always add. These are just a few. Shoulder and joint stabilization kind of goes with exercise that I just said. We want to make sure that you are strong and stable in your foundation of your shoulders and your back. Nerve glides if there's nerve issues going on, cording if there's nerve glides if there's cording going on or nerve issues. And then other treatments, I mentioned low-level laser. Don't use it very often, but we use it on occasion. Cupping is really more of a manual technique than it is traditional cupping, but it's helping to soften and mobilize. And then some people need compression because there's also swelling on top. So it's going to vary person to person, but these are also things that you might see along with things like breathing techniques, postural training. There's a few more. One thing I want to also just make sure is clear. Hopefully I've brought this across clearly, but we can't get that tissue that has fibrosis to go back 100% to what it was before. Unfortunately, it's not realistic. Yes, it varies. Some people have minimal change and some people have a lot of change on their tissue. And that's going to vary based on the dosage they had, the area that it was, and really genetics plays more of a role than we think. But I always think that like a balloon, if you have a brand new balloon that you never blew up and you had a balloon that had been blown up and you took the air out, that texture is going to be different from the before and after of the balloon. It's kind of like the tissue. Unfortunately, it's never going to be 100% the same way it was. So that's not the goal of what we do. The goal is, can you reach overhead without pain? Can you sleep through the night without being woken up from that restriction? Can you get dressed, drive, carry your groceries, play with your kids and your grandkids without your tightness and pain being what's limiting you and the barrier of doing all that? That's what we're trying to do. We're trying to improve your function, reduce your pain so that you feel better with that. And then just to wrap up, a couple things that you can take away. If you're like, where do I start? The first thing I would say is ask your doctor, ask your oncologist. Most of them should have a list of who you can refer to if you have someone in your area. Is there someone in cancer rehab in your region? That would be a great place to start. You can also bring up fibrosis. We always, if something feels new and it wasn't there before and you're not sure, I always encourage my patients to just go check with their oncologist, get clearance for anything that might be new. And then you can ask them if they, it all looks good. Is this fibrosis? Okay, let's address it. You can also, if you're doing your own research, these are some credentials in the US. Some have an oncology specialist. And then a lot of certified lymphedema therapists have been working in this area for so long. They're also trained enough to treat it. So you can check with your CLTs in your region too and see if they're comfortable. I get asked a lot about if general PT helps. I don't blame anyone. We don't get that in general training. And so I don't know their comfort level, but a lot of times I would say they don't have that next level of training if you're looking for that. And I just want to say thank you for being here. Thank you for Amanda and also Steve for sponsoring and letting me talk about something that I'm passionate about. I hope this gave you a clear picture of what's happening in your body, wherever you might be on that continuum, maybe looking at what you've tried for treatment, what you haven't, and seeing if there are gaps that you can try and hopefully get support for the symptoms and the side effects that you have. Like I said, there's never such thing as too late. There are possibilities at all timelines. And I just hope that was helpful. If you have questions, you can find me. I have my socials and my website there. Feel free to ask questions. But just know that you're not alone and there is a path forward.
Thank you so much, Kelly. And again, I just want to echo what Kelly said. It is truly never too late to get support for any of the breast cancer related side effects that you can possibly be experiencing. And if you need help finding a specialized oncology PT or occupational therapist, that is one of the things that we do at Well Beyond Breast Cancer. So please don't hesitate to reach out to us. Our email is there. You can also reach out to us through Instagram, whatever's easiest for you. So we'll now open up the Q&A section. Just a kind reminder, we just ask that you ask all questions through the chat box, and we just do this to protect your identity since the recording is going to be up on YouTube and on our website. We do have a first question, Kelly. The person asks, my therapist uses ultrasound. Do you use that as well?
I personally don't use ultrasound. I do not. I use a lot more hands-on techniques, a lot more manual techniques versus devices, because for me, I feel the texture and the changes so much better. So I know what I'm working on. So not something I focus on personally.
Great. If you have any other questions for Kelly or for Steve, he is still around. Please feel free to leave them in the chat. So not a question, but we just started fascial stretch therapy and it's already making such a difference. I mean, that's amazing.
Yeah, it really is. And I think that's a power too for those who maybe have tried some sort of manual and didn't work. Again, there are multiple layers of tissue. And so kind of think about what did you have? Fascial would be more top layers. There might be other options, again, other things we haven't tried that we can.
Absolutely. And I think just to highlight just the stretching as well, I mean, a lot of people are doing stretches, but are quicker at doing stretches, maybe because they're uncomfortable or they're not sure as to how long they should be holding these stretches. But there is a lot of research to show that really these sustained stretches and adding that deep diaphragmatic breathing can really help that tissue to kind of relax and then lengthen. And I love that you mentioned diaphragmatic breathing, Kelly. That's something that I teach all of my patients to also incorporate into their stretches.
Yeah, absolutely. And if you feel like you get into a stretch, you're like, this doesn't feel good, try something more gentle, or, if you're on your back, like pictures, you can put towels under you or some sort of pillow under you so that you're just scaling it down to find and like meet yourself where you're at. That's more important than anything.
Yeah. Someone says, thank you for recognizing that we don't have to accept that this is a new normal. It took me months to get diagnosed with radiation fibrosis.
Yeah, thank you for sharing that. Unfortunately, it's such a common thing that we hear. And I know Amanda and myself both are something we just continue to advocate and help you all know that there are resources and options. And we hope that we can help you find it.
Mm-hmm.
And Amanda, one thing that other physical therapists have found is if you use the BeeCure, if you need any kind of moisturization or, as you're doing the hands-on, as Kelly said, you can actually use the BeeCure to massage in. Again, it's not oily, it's not greasy, it goes in, but it just gives, there's a company that's associated with the National Lymphedema Network. They actually are giving it out as part of some of the equipment they're using because they needed an adjunctive basically to go along with it. So just if people want to try it for that, even you're basically nourishing the cells and feeding them with polyphenols, flavonoids, and other nutrients at the same time. So another great use for it.
And Steve, I really appreciate you sharing that. I think there's two pieces to it. We use it as like, we call it an emollient, like something that feels better when you're doing it. But the other thing that's nice is, how do you find time in the day to do all of this? There's already so much on your plate. And so something simple would be, as you put your lotion on in the morning for your minute or two, can you do a little extra massage in that area? It's a way to get you to be more consistent, and you're kind of doing two things in one.
Great combination. Love that.
I love that. Someone asks a very, very loaded question, in my opinion. Why do you think PT isn't considered a standard part of cancer care? Not post-surgery, but for long-term care and prevention. And I love this question, and this is exactly why Well Beyond Breast Cancer exists. So physical therapy, cancer rehabilitation, oncology rehabilitation is actually considered a standard part of high-quality cancer care by the NCCN, ASCO, and other organizations. But as Kelly mentioned, there are so many barriers to people accessing this care. One is insurance coverage, high out-of-pocket costs, a lack of a specialized therapist like Kelly mentioned. So for a lot of people, there won't even be someone within their community. But there's also a big lack of awareness, not only amongst the breast cancer community, but other healthcare professionals as well. And so this is something that we are working very hard on at Well Beyond Breast Cancer, is to really bridge a lot of these barriers that are preventing people from getting the care that they truly need. And it is our vision that breast cancer rehabilitation is truly integrated as a standard part of cancer care. So we are working hard on that and hope that we will see that in the near future. I don't know if you want to add to that, Kelly.
Yeah, it is a very loaded question. There's a lot of things. It's, that's what we're trying to do, is bring more awareness. If a hospital system has a credentialed, with NCCN guidelines and whatnot, they actually are supposed to always have at least referrals for cancer rehab, prepared. And so that's why I say, reach out to your oncologist, ask for referral. They are supposed to have a list. I understand that not every area has access, but if you're in even a metro area, there should be a list for you. You just might have to self-advocate and ask for it.
Yeah. And like I mentioned before, if anyone needs help finding a specialized PT or occupational therapist within their community, this is something that we do at Well Beyond Breast Cancer. So please do not hesitate to reach out to us via email or through DM. Like I mentioned, we are very happy to help you connect with these local therapists. And if you are someone who's experiencing financial hardship to even access this service, please don't hesitate to look at our financial assistance program. That program is built to bridge this financial barrier to just make sure that you're getting the care that you need. Does anyone have any other questions for Steve or Kelly before we wrap up? A lot of people thanking you for this wonderful information. Is there any specific book where we can read more about radiation fibrosis?
I will be completely honest. I have all the textbooks sitting over here in my corner, and there's one that has a section on radiation fibrosis, but it's really just not detailed. The cancer rehab one doesn't have a section on it. We're pretty far behind. So we're working on it. We're getting there.
All right. Well, I will just like to thank you again, Kelly, so much for taking the time to just share this information with everyone. And thank you again to BeeCure and Steve for being here and being able to provide this, sponsoring this webinar makes us have the ability to be able to provide this free to our community. So I thank you so much for all that you both do for the community. And like I said, if anyone wants more information about anything, all of our contact information is there. And like I said, we do these webinars monthly, so please be on the lookout for the next one. And we will see you guys in a month. Thank you.
Thank you.
Thanks, everybody.